Hello and welcome to the podcast by Astitva Prakashan. Today we have Dr. Purva, a dedicated educator and a public health expert with a strong foundation in community medicine. Hello and welcome, ma'am.
Good evening.
Good evening,
I'm
ma'am.
glad for this interview.
Most welcome, ma'am. First of all, I would love to congratulate you on the release of the book. Many congratulations.
Thank you.
So, ma'am, what are the reviews you are getting from the friends, families, and your students?
Students, I'm teaching undergraduates and postgraduates, and they are quite happy that a book has been released, but they want the hard copy, and I'm awaiting the hard copies right now. Many of them have already taken the ebooks, and they kind of like it. They have to study. It's not like one day's novel. They have to really study and imbibe the subject. So it's like that.
Absolutely. Ma'am, I would love to know what inspired you to make a second edition of the book on cardiovascular prevention.
The first book was published in 2023. It was a multi-authored effort, and what we did was a lot of hard work. But for publishing, we made it in a haste. So when I was reading my book, the first two chapters I didn't like. So when I just saw them, I was like, it has to be updated, and it was always on the back of my mind. So when I got time, I thought I'd re-revise the whole book. It is latest. It is having minimal plagiarism. It is one of it is a literature review, and we have studied so many of the journals to compile this book.
Absolutely. So, ma'am, how does this book differ from the previous edition in terms
The,
of content and approach?
it is It is with more recent guidelines, whatever the European Society of Cardiology and American Heart Association, as well as WHO guidelines. We've clubbed all of them and we have compiled this book. It's latest. 2024 guidelines have been included. And we have re-revised everything. We have made it little, whatever was extra, not needed, we removed. We added things like there were just 14 factors, risk factors described. In the new version, we have also studied gut microbiota that separately as a chapter. And gut microbiota has an impact over cardiovascular health, on diabetes, on hypertension, on obesity. So all that has been covered. Even in the diet therapy portion, we have talked about dietary fibers, we've talked about gut microbiota, and that is like something which has been added to it. Basically, this book is about precision sciences. I believe in precision sciences. It's not like every other individual with some risk factor will get a heart attack. So, to postpone the event or to not succumb to cardiovascular disease, this book is very valuable.
Absolutely. Ma'am, in today's world, we have seen rising cases of heart attacks amongst the youngsters or the teenagers, basically. So, how can we prevent a heart disease? Like our body shows signs, right? And we sometimes we don't understand it. So, could you please suggest some of the simple things we could understand our body? And
Firstly, obesity is an independent risk factor for heart disease. So, having a good diet, which does not include trans fats, recently it was in the news that there are a few European countries who have removed trans fats absolutely from their packaged foods. So,
absolutely,
trans
ma'am.
fats are very dangerous, and the populace in India is keen on having a lot of packaged foods like
Yeah.
chips, or they can eat wafers, they can have some chocolates, they can have many other things. Namkeen, for example, we are very fond of having that with our tea. So these
Yeah.
things do contain trans fats. So any packaged food should not be allowed to children, especially. And if we have good nutritional habits, we Basically, to avoid heart disease, if there are 15 factors described in the book, out of them, two or three, if you tame, like physical activity, diet therapy, maybe some nutraceuticals, or otherwise abstaining from alcohol, smoking, not taking stress, sleeping properly, avoiding packaged foods, clinging on to good diet. So whatever we do, two or three tamed factors will avert heart disease. It's not like all 15 things you have to incorporate in your daily lifestyle. It's a lifestyle disease. So for foremost, to prevent young deaths, we are supposed to control our diet and nutrition. And the second thing is stress factor. Stress factor is there and it is causing a lot of demise, if not through heart disease, through suicides, through drug abuse, like that. That's what
Absolutely.
it is.
Yeah. Ma'am, I would
Mm.
love to know, like, there are many cases on people, those who are working out in the gym or outdoor, are having sudden heart attacks. So there must be some symptoms about that as well. So how can we detect it and how can we prevent at the moment? What prevention should we take at the moment?
Uh, Excessive exercise also, like
Yeah.
very vigorous exercise. Exercise is important, but just exercising, not having good food, or excessive protein diet. We say that we are having protein supplements to build muscles, it is detrimental to health. We're not supposed to do that. Extra protein in the body is not required. We need a simple diet. If you're having something like khichdi dal also, that itself will protect you. But having extra nutrition in the form of so many proteins going into the body apart from what is required, that is
Mhm.
why, according to National Institute of Nutrition, they have reduced the daily value of RDF protein to 0.8 grams per kg body weight. It was 1 gram, 1.2 gram, and the bodybuilders they used to take 3 grams, 4 grams, 5 grams. It is absolutely not required. In one of the chapters in the book, we are discussing sports health. So, sports health. So, those people we were thinking that need a lot of protein, but no, they just need carbs. They can have carbs and they have to work out for it. Protein requirement remains the same. Whatever your weight is, you have to take accordingly 0.8 grams per kg. So this particular factor, protein, is misused by the gymmers, by exercise people, by athletes. That is not required. What you have to do is you have to have a balanced diet. That is the reason. Second reason is that when you have palpitations, people have palpitations. Some people will say evening time, my heart just starts sinking. These are some symptoms: diaphoresis, depression, hypothyroidism. Some endocrinopathies will be there. Some family history will be there. So we are supposed to control the way we exercise. We should know our bodies. It's not like in one day we will just build our body. It should be slowly and steadily. When our body adapts to physical exercise, we can increase our activity. And that is why physical activity guidelines are there according to WHO, and it has been beautifully written in the book. So those who are keen to know how to eat, what are the meds that they have to burn, what are the
Mhm.
activities that will burn most, all that has been included in the book. So it's kind of, yes, it's sad that many people are dying, but there are other factors. Environmental pollution is also a factor,
Yeah,
like air
absolutely.
pollution. Air pollution is on the rise and it is a very dangerous factor because nobody knows that they're intaking so much of poison in life. So that is
Yeah,
another thing that has to be uh, taken into account. That's the thing.
absolutely, ma'am. And ma'am, how does your book help undergraduate, also postgraduate students? I would love to know.
Non-communicable diseases is in the curriculum of community medicine. And the risk factors are common for cancer, for heart disease, for diabetes, for hypertension, for obesity. Common risk factors are there. Sometimes fatty liver disease. So to prevent them, we have a very good in first two chapters that I'm talking about. They have a lot of knowledge about risk factors epidemiology. It is not given in the conventional community medicine books. So to study these risk factors is enough for the undergraduates, and for the postgraduates who are dealing with primary healthcare, who are about to go and continue in government settings or are involved with WHO or national program for prevention and control of cardiovascular non-communicable diseases. So NPNCD, which is there. So for NPNCD, postgraduates will find this book very helpful. They can strategize, they can do research in the subject. Basically, for postgraduates and beyond, community medicine enthusiasts, public health enthusiasts, cardiologists, preventive cardiologists, public health experts, common man, other sciences people like nursing cadres, whoever reads this book will have so many points and insights that every other thing, if they read carefully and critically, it will be room for research. For example, to know the ethnicity of Indian population and providing guidelines, because we are following some European guideline, we're following some American guideline, but for India itself, there is no guideline, and we are so diverse in our ethnicity. Northeast people are different, North Indians are different, South Indians are different. We have obesity as a pandemic in Tamil Nadu, Punjab, Delhi, these states.
Absolutely.
So for those people, we will have different values or parameters than the other population. So research needs to be done on how it affects, because when I was reading for the literature, there was so much about blacks, there was so much about Caucasians, but there was
Yeah,
nothing like Asian Indians. Asian Indians.
absolutely. Yeah,
So that is why it will give many insights and people can come up with research. That's academics, and that is what my aim is about for this book.
absolutely, ma'am. So, ma'am,
Hmm.
how can policymakers and health workers use this book as a guide to real world for
If we have
decision
health
making?
workers, we have preventive modalities separately discussed. Ayush practitioners can use it. We have given some insight about how it can help. And we are mainstreaming Ayush in NRHM. ASHA workers are already working on population based screening for diabetes and hypertension. We have health workers who can sensitize themselves with first aid. There are some civil engineers who can take care of it. Some type of building codes can be created. Suppose there is some heart patient living on the sixth floor. He gets a heart attack and
Yeah,
the ambulance doesn't reach on time.
yeah,
So there are many ways in which this can be prevented by having a defibrillator in the vicinity, by having some digitalization, some alarm that yes, this person is having heart attack and needs help, or like local people living in the society in the same building can help them out if they know
yeah,
about first aid in heart attack or cardiac arrest or such factors. And high-rise building में we should have proper lifts so that the ambulance people can quickly reach the place. So
yeah,
those things are there. We still need good ambulance services. Not every hospital has this facility. Not every city has this facility. In fact,
yeah,
so these
absolutely.
things. So developing health in the country requires these types of measures. That's what I think.
Yeah,
So the built environment affects your heart health. The greenery around you, the sea around you, the desert around you, it can heal. Nature can heal. But there's no nature to be seen nowadays. So those
yeah,
are the
absolutely. Like the Delhi is like on a, it's very tough for like heart patients and in fact asthma patients as well because the pollution, air pollution, water pollution, like every kind of pollution is present out there, we can say actually. So yeah, it's very important. Ma'am, I just want to ask, like, your book is multi-authored book, as I can say. So, how did you coordinate for the research, revise, and then like writing the book? I just want to know about it.
We were colleagues in JNU, Jaipur National University, and later on we dispersed to different institutions. And when it was first written, girls were very enthusiastic. There were some boys who said, I will also write. We were like, fine, because I had already planned the contents and everything, the format and everything. So they were saying, we'll write the book. I did not encroach upon their creativity. I told them, khul ke likho. The way you know, you have to
Yeah.
write according to that. So no language problem, nothing. Then the first edition and plagiarism check was my part. The first editing part. The first
Yeah.
editing part was mine. So after editing, I gave them back. They gave it to me. Second editing. After
Okay.
second editing and plagiarism, when we were sure of it, I gave it to Dr. Prabha Srivastav and Dr. Vishal Bankal, who are also co-editors. So they did the third editing, and then after the third editing, we thought of reading ourselves individually, divided the chapters, and we checked everything. It was the fourth editing, and finally proofread when the book got compiled. So
Oh,
5 times, 4 to 5 times, I've gone through each chapter, both in the first edition as well as in the second edition. But I was not happy with the first edition because that was in haste. It was a lot of
okay.
pressure on my head. They were like, please publish it soon. So I was like, I
Uh,
need time to think about the book and see what all can be added. So it was always on my back of mind. I have to check this book, I have to recheck it, I have to recheck it. But when I changed my university, became a professor, I in 1 year's time,
yeah.
then I got some free time. So then I decided that this book needs to be rewritten. So rewritten in the sense the content, the authors are the same, but it is more revised. And there was no haste in doing it. I did it very slowly and nicely. So this is exactly what I wanted. And now it won't be in the back of mind unless some breakthrough happens and I'll come up with the third edition. Like that.
Absolutely, absolutely. Yeah. So, ma'am, how did the diverse experience of all the three authors enrich this book? I just want to know about it in the
These
perspective
authors,
of content. Yeah,
what they think about the book.
yeah, absolutely.
These people, they're all community medicine experts, professors, assistant professors, associate professors, and we have a knack of preventive medicine. Like, what are the principles of preventive medicine? Whether it is primary healthcare, secondary healthcare, tertiary healthcare, all three are requiring prevention from one stage to the next. Primordial prevention, the risk factor itself should not happen. If risk appears, then it should be like it should not affect the person. If it affects the person, it should be early diagnosed and
Yeah,
treated. And once early diagnosed and treated, then it should not lead to disability or death. So those
yeah,
things we have to prevent at every stage heart disease. Wherever we can prevent and prolong life, that is the way we have to study. So these people, they're already acquainted with these things, and we're teaching so much about non-communicable diseases in our clinics, in our classes. So I thought that they all have caliber. I don't underestimate the person who is wanting to contribute, because I feel that everybody has their own way to express themselves,
yeah,
and
absolutely.
they are basically qualified.
Yeah,
So when I asked them how you find the book, they was like, "Wow, we are writing another book." Then they were all like, "Fine, it's really a great endeavor." We had a last section, case summaries. So one of the editors, I gave them the book. He actually put up so much of information about ECG itself, which was not required in the first, which was not there in the first book, but
yeah,
everything was so scrutinized, so deeply scrutinized. So that way, I was happy, and I knew that people want to write and be a part of the book. And
yeah,
when I told them that it is being released, they were on cloud nine. They were like, "We are so happy about it, and I hope we come up with other books also. Those were the responses that they told me.
Absolutely, ma'am. So, ma'am, where do you see the future of India or like all the world in preventing cardiology diseases?
India needs a lot of uh, work in this direction. It's preventive aspect,
Yeah,
and
absolutely.
I won't say that the world is perfect. Even the world needs measures. But what India, I've already answered that question. That we need research in this direction for our own population, so that we do not follow the guidelines which are foreign to us. So the
Yeah,
guidelines should be Indian guidelines, and they should be evidence-based guidelines, not copying from others. So
yeah,
that work
absolutely.
is has to start from zero, in fact. So that means it has a lot of scope in India, and I feel that because here what we do is we just sit in the clinic. Anybody comes, okay, तुम hypertension के patient हो, अच्छा ये लो ये AC inhibitor ले लो, 3 combination में आता है, calcium channel blocker है और साथ में diuretic है, तो ये खा लो तुम ठीक हो जाओगे. The patient doesn't come back to the same doctor. So
Yeah,
follow-up care is very important in India, and one must make sure that the patients follow them. They are advised preventive modalities. They're told about the risk of cardiovascular disease, because something I have to say is that these diseases are symptomless. Many
yeah,
people do not have symptoms.
yeah,
So they're eating the person is unaware. So it's not an urge for the person to leave sugars, leave salt, or to change diet or start exercising. So those lifestyle measures people don't take unless they already have a bypass surgery. They're already done with heart, so then only they will think we have to control all those things. So
absolutely.
that is one thing. And second thing, for global health and cardiovascular diseases, they have come up with precision public health. Not one treatment holds good for everybody. One person who comes or one community that comes. So that person will have a tailor-made treatment and prophylactic profile or regime that they have to follow, and it has to be followed up again and again and again. And this way, sure that the behavior change has been incorporated and this person can survive on his own. So those things we have to see. That's a precision public health or precision preventive cardiology. That is tailor made to the needs of that particular person. Because every life counts, we cannot lose life. Obviously, it's not like if we have so many numbers, everyone should die. We can't say
Yeah,
that. Whoever
no,
comes
no,
to
no.
this earth, one has to live. So, in
Yeah,
any circumstances. So, even if with heart disease. So, that heart disease has to be taken care of. And
yeah,
when I was younger, when I was doing my undergraduation, I used to tell
yeah,
my parents also that first rule out heart. I was always good in this subject. So I used
yeah,
to say, if anybody comes with a heartburn and you think it's gastritis or you think it's anxiety, please rule out heart.
yeah,
First thing is to rule out heart and then go on to other easier diagnosis. Because you lose people in 1 second in this particular disease.
absolutely, ma'am.
That's the
So,
reason.
yeah, ma'am, I want to know your journey to become a doctor, professor. How did it start?
Mine is a very tumultuous journey, very, very, what to say. The thing is that I have not done my undergraduate from India. I
Okay.
did my undergraduate from Russia, from Moscow, and
Yeah.
I came here without coaching, without anything. I was able to clear my FMGE exam and do my internship on time. Then I decided I'll go to Karnataka and complete my post graduation in community medicine, because community medicine was something I thought is a 9 to 4 job at that time. So 9 to 4, 9 to 5 job that you do, you get time to develop academically and do research. So I've been very busy with all that. Around 15, 16 researches I've already done, and so, but I've faced so much of discrimination because I did not do my UG from India. But that
Oh,
discrimination doesn't affect me now. I've become a strong person now. So even if somebody says that you are discriminated against, because I don't find any other reason behind people talking at my back or
discriminating
something.
about, yeah. First of all, why do we discriminate? That
Hmm. Hmm.
itself is a factor.
Hmm.
And yeah, ma'am, please continue.
So now that's all over. Now I'm at this stage, already a professor. Why to look back? It's a
Yeah.
journey of learnings. They have sacrificed, my teachers have sacrificed teaching me back in UG, back and then in post graduation in Karnataka. They have exposed me to research methodology so much that I critically analyze whatever literature I'm reading, understanding, making notes, drafting, editing. So it has made me an academician. Yesterday, I was writing a chapter for my another book. So uh, I don't want to boast about it, but what I want to say is it was 0% plagiarism.
Okay.
0%. There was no copying in it. It was around 23 pages. And when I was editing it, I was proud of myself. So you do things for yourself. You don't do it for others, for your academic growth. And if people benefit from your work, that's that's satisfaction, nothing else. That's my journey. That's the only
Absolutely.
thing.
Ma'am, I would love to thank you to do research on Indian people because we ourselves don't have exactly what we need. We always copy from outside,
Hmm.
which came from outside. We are going
Hmm.
according to it, like the medication are being given and everything. It's from outside because from India we are more into the Ayurveda kind of thing back in our times, back in ancient India, and we lost it somehow. So thank you so much for starting it again and being for continuing the research on such vital organs. Actually, I could say because heart itself, from my personal experience also, so, heart is something the whole body stands on.
Hmm.
So it's that vital. So thank you so much. I would really want to thank you again. And yeah, what's next for you, ma'am? As you said, you were writing something, so I'm expecting
Um,
another book. And what else are you thinking of? Like, is it another book
next
or
is
further research?
next book that will be published in another week's time. It is on social dimension of health and its social pathology. So social pathology is a social aspect of it is totally Indian book and totally multi-authored. We have discussed gender, politics. We have discussed say culture of India. We have all those things that affect health. Research methodology we have discussed. We have found out ways of systems thinking, how to revamp Indian system. So that we will discuss later some other day. But that's what.
Absolutely.
This is the next book that I was writing about. It's also a multi-authored book.
Okay, okay, ma'am.
Yeah.
So I'm really excited for your next book, ma'am, and thank you so much for being here and sharing your insights with us today. And it was a pleasure having you and knowing more about such vital things. Actually, the small things we ignore, and those are so vital in our life. Actually, so thank you so much, and it was a great time having you. I'm awaiting for you to have you again. Yeah, thank you so much.
Thank you so much. Thank you. Pleasure.